guys, how are you doing? I hope you are doing well and welcome to today's session of learning. How have you been? I hope you are doing well. It's been a while since I posted a video. I took a short break, but now I am back like I never left. So thank you so much for tuning in to watch this video. If you're a new member, feel most welcomed. If you're a member, karibu sana. Thank you so much for subscribing and always watching my videos. If you have not subscribed, please consider subscribing and let's grow this channel. Today I want us to talk about sexually transmitted diseases. So I want us to list all the diseases that are sexually transmitted, and I also want us to know prevention measures. How can you prevent yourself from contacting sexually transmitted diseases? And also the risk factors, okay? So, and also I want us to know who is most affected by the sexually transmitted diseases, okay? So make sure you watch the video till the end, and if you have any question, ask me down there in the comment section. And also if you have any suggestion of any video that you want me to do, please you can do so in the comment section. So what are sexually transmitted diseases? These are infections that are transmitted through sexual contact from one person to another, okay? These are infections that are passed from one person to another through sexual contact. Those are what we call sexually transmitted diseases. You get this disease when you engage in sexual activities with someone who has the infection, okay? So who is affected by sexually transmitted diseases? Sexually transmitted diseases affect both male and also female, okay? But the only difference is that women tend to have more complications, okay, or serious complications than male, and also female tend to develop severe symptoms than male do. So, but both male and female contact sexually transmitted diseases, okay? So I want us to know some of the symptoms of sexually transmitted diseases. Yes, sexually transmitted diseases are different and they have different symptoms, but there are those common symptoms that cut across almost all the sexually transmitted diseases. Number one, we have a discomfort during sexual activity. If you notice that during coitus, you either you feel pain during sex or pain after sex. You might be having not necessarily that you are having a sexually transmitted infection, but it might be a sign that you're having a sexually transmitted disease. Number two, we have unusual discharge from the penis or from the vagina. Normally, the penis is not supposed to discharge any fluid, okay? Unless during ejaculation or during micturition or urination. Otherwise, the penis is not supposed to discharge anything. And also for the vagina, there's that normal discharge for ladies that has no odor smell. But if you notice that you have a very odor discharge, you might be suffering from a sexually transmitted disease. Number 3, we have sores or warts on the genital area. If you notice that you develop or you grow some sores, okay, or some warts, either on your penile or on your scrotum or on your vagina, that is another sign of you might be having a sexually transmitted disease. You also have painful urination. We have itchiness or redness in the genital area. We have abnormal vaginal odor, that one I have said it. We have abnormal abdominal pain in your abdominal area. If it's not cramping or during your menses, then you might be having a sexually transmitted disease actually that has advanced, because for you to have abdominal pains, it means you contacted a sexually transmitted disease that was not cured, and it has advanced. It has affected either your uterus or your or your cervix. We also have anal itchiness, soreness, or bleeding. This is mostly brought about by a sexually transmitted disease called chlamydia. So, what are some of these sexually transmitted diseases? I want us to list a few. There are so many, but I will just list a few, those ones that are most common, okay? The ones that are most common. Number 1, we have chlamydia. Have you ever heard about chlamydia? It is a sexually transmitted disease that can result to infertility. That is how serious chlamydia is. Its symptoms usually occur between 7 to 21 days after exposure, but it can also decide not to give you any symptoms until it affects maybe the cervix or the uterus, because mostly these sexually transmitted diseases, they don't show symptoms. Or they might cause mild symptoms, okay, that will lie to you. You won't seek medical attention, and that's how it will just progress and cause more serious damage to your organs, okay? So number 1, we have chlamydia. We have genital herpes, okay? This is caused by the herpes simplex virus. Another thing I forgot to tell you is that these sexually transmitted diseases, if it's a virus, it has no cure. But it's caused by bacteria, then you will be given antibiotics and it will clear, okay, before it causes more damage, okay? So the earlier it's treated, the better. Genital herpes is caused by herpes simplex virus, okay, that remains in your body dormant for so many years, and sometimes it might cause blisters around your mouth, your anal, or your genital area. If you see these blisters, you can go and seek medical attention, okay? Number 3, we have hepatitis B. Hepatitis B caused through sexual contact, and if left untreated, it causes liver damage. we have Trichomoniasis, we have HIV/AIDS, which attacks your immune system and predisposes you to so many illnesses. It has no cure. We have human papilloma virus. This one causes genital warts, okay? And it also increases the risk of getting cervical cancer and also throat cancer. We have syphilis. Syphilis is potential serious infection, okay, that is supposed to be treated early before it causes permanent damage to your genital, to your organs, okay. It causes long-term complications. It has 4 stages. So before syphilis proceeds to stage 4, you will get some symptoms. So make sure you get treated before it causes serious damage and also infertility. We have gonorrhea and we also have chancroid, okay? Those are some of the most common sexually transmitted diseases that we have. So I listed 9 of them. These are the most common ones. I will tackle each one separately. That's when I will let you know their symptoms, how they present, so that in case you see those symptoms, you seek medical attention early, okay, before they cause serious damages and also infertility to women and also to men. And we will get to know each one of them, okay? If it's a virus, if it has a cure, if it's a bacteria, and its medications. So what are the prevention measures for sexually transmitted diseases? Number 1, we have abstinence. Abstain from sexual activities. If you don't have a partner, okay, if you don't have a partner who is willing to stay faithful, okay, you better abstain, okay. Abstinence is the most effective way of preventing sexually transmitted diseases. Number 2, correct and consistent use of condoms, okay. In other words, practice safe sex. If you're having sex with someone you don't trust or you don't know their status, go ahead and use a condom. Always. Number 3, we have vaccines. We have hepatitis B vaccine that will protect you from getting hepatitis B, and we also have the human papilloma virus that will protect you from getting genital warts and also cervical cancer. So these vaccines, you're supposed to get them early before you start engaging in sexual activities. For those who have young ladies, small girls who have not started engaging in sexual activities, you can inquire from the nearest facility, know if they have this hepatitis and also human papilloma virus vaccines. Get your baby vaccinated, okay. And now another one, stay with one partner who is not infected. Talk to your partner, get tested. If they're not infected, stay with that partner for a lifetime, okay. Stay for that partner for a lifetime. One partner who is not infected. Another one is avoid excess alcohol. You know what? Alcohol impairs judgment. So when you are drunk, you can do anything. You can engage in sexual activities with people you don't know, and you will end up contacting sexually transmitted infections. We also have what we call PrEP, post-exposure prophylaxis. If just in case you engaged in sexual activities with someone you are not sure of their status, rush to the hospital, talk to your doctor so that they can give you these medications that will protect you from contacting HIV, stroke, AIDS. Okay, what are the risk factors of contacting STIs? Number one, we have unprotected sex. If you practice unprotected sex with someone who is infected, that's how that person is going to pass that infection to you. Number two, multiple sex partners. So risky, because you don't know who has it, who doesn't have it. So it's wise to engage in sexual activities with one partner who is uninfected. Okay, so talk to your partner before you engage in sexual activities. Get tested first. Number three, misuse of alcohol. As I said, it impairs judgment. Okay, I've encountered so many people who come to the hospital for PrEP. Of course, that was a nice step, coming for PrEP. After engaging in sexual activities with a stranger after alcohol misuse. You see, misuse of alcohol puts you in a risk of getting a sexually transmitted disease that can be cured, or a one that doesn't have cure. So if at all you have to take alcohol, you have to drink responsibly. Okay, otherwise you will mess up yourself. But if you find yourself in a state that you engage in sexual activities with someone you are not sure about their status, just go to the hospital and get PrEP. And also, young age people between 15 to 24 years are at a risk of getting sexually transmitted diseases, because this is that age that people explore so much. Also, they don't have much information about these infections, so they end up being infected. So it's good for you to talk to your teenager, let them know that there are these sexually transmitted diseases, so that they engage in safe sex. Okay, so in my next topic, we are going to tackle these sexually transmitted diseases one by one, so that we can know each one of them and its symptoms, so that in case you notice that you have those symptoms, you will seek medical attention early. Okay, yeah, so that is it for today. Thank you so much for watching. If you have a question, ask me down there in the comment section. If you have a comment, leave it there. If you have any topic, suggest down there. And also, do not forget to subscribe, and see you in the next session of learning.